So there is a MCQ that is very confusing. In COPD, choose the correct option. Exhibit both shunt and dead space and shunt only. In COPD, there is both phenomena, both shunt and dead space. The A option is correct. We will explain later the concept. Chronic bronchitis, V by Q is equal to 1, V by Q is equal to 0, V by Q is more than 1. That is V by Q is equal to 0. In emphysema, what happens? V by Q is more than 1. Now I am giving the reference of Guyton. It is clearly mentioned in the Guyton. You can see over here. This is a Guyton book, page number 501. So in a COPD patient, we are having actually two things: the chronic bronchitis and emphysema. So what happens in the chronic bronchitis? The bronchioles, the small bronchioles, they are obstructed. When the small bronchioles are obstructed, the alveoli beyond the obstruction are unventilated. Now this is the phenomenon in case of chronic bronchitis, when there is more secretion blocking the small bronchioles, so the alveoli distal to those small bronchioles which are obstructed, they are unventilated. So the V by Q approaches 0. V by Q approaches 0. This is in the case of chronic bronchitis. Second, in those areas of the lung where the alveolar walls have been mainly destroyed, now they are talking about the emphysema. The main pathology in emphysema is the membrane destruction. The alveolar membrane, the membrane where the gaseous exchange take place. So there is still ventilation, but there is no gaseous exchange. So the blood flow to that part is there. And there is also maximum amount of air coming to that area, but that is not taking part in gaseous exchange. So the dead space increases. So if they ask about the COPD, so in COPD, serious physiological shunt, some area serious physiological shunt and some area having dead space. So the answer in above is in COPD exhibit both shunt and dead space. Another is if they talk about the chronic bronchitis, then V by Q is equal to 0. V by Q is equal to 0 mean shunt. V by Q is equal to 0 mean shunt. V by Q is more than 1. This is dead space. V by Q is less than 1. This is shunt. V by Q is infinity. This is pulmonary embolism. Massive increase in dead space. And V by Q is equal to 0. 0 mean less than 1. So this is shunt, because V is 0. In chronic bronchitis, if bronchioles are obstructed, the alveoli distal obstruction, they are not ventilated. If they are not ventilated, so the ventilation over there is 0. So anything, so if 0 is divided by anything, the answer is 0. V by Q becomes 0. They can ask about in chronic bronchitis what happens. There is shunt. There is not dead space. There is mainly shunt. In emphysema, we are having destruction of the membrane. So if the alveolar membrane are destroyed, so there will be no gaseous exchange. If there is no gaseous exchange, there will be increase in dead space, massive increase in dead space. So for dead space, we are having V by Q is equal to V by Q more than 1. So COPD consists of two things: the chronic bronchitis and emphysema. And the two terms, the pink and the blue bloaters and the pink buffers, they are now obsolete. In COPD, you will find the mixed picture. You cannot find the pure bronchitis and you cannot find the emphysema. So there is some degree of overlap in any COPD patient. So in chronic bronchitis, the main phenomena is the obstruction of bronchiole by secretion. So whenever there is obstruction of bronchiole by secretion, so the alveoli distal to the obstructed bronchiole, they are not ventilated. So the V is equal to 0. So 0 divided by anything becomes 0. So V by Q is equal to 0. So this is shunt. In emphysema, the main thing is the alveolar membrane damage. When the alveolar membrane is damaged, there is no gaseous exchange. When there is no gaseous exchange, so the amount of air that does not take part in exchange become maximum. So there is increase in dead space. So we become maximum. So increase physiological dead space, no exchange. In chronic bronchitis, bronchioles are obstructed. In emphysema, membrane is damaged. This membrane where the gaseous exchange take place. But in COPD, you will find the mixed picture. So there is a mixture of both shunt and dead space.